Suicide is a painful reality in Colorado and Summit County. Our state average is 3 times higher than the rest of the nation, and our county rate is even higher than that. Mental illness plays a role, but local experts like Dr. Cassic Comeau with Summit Community Care Clinic want to change the perception it's taboo to discuss. Comeau says local rates of anxiety and depression are rising, and that mirrors the rest of the country, especially for youth and students. Earlier this month, a student at Summit Middle School took her life, becoming one of the county's youngest suicide victims. It shocked officials, and they are working hard now to develop new programs and avoid another tragedy. We talked with Comeau and Julie McCluskie of Summit School District about the state of mental health at local schools. Phil Lindeman, Krystal 93 News Director, in the studio today with Julie McCluskie. She's Director of Communications and Community Engagement for Summit School District, and Dr. Cassic Comeau. She's Chief Behavioral Health Officer at Summit County Community Care Clinic. Thank you two for joining me.
Thank you.
Of course. And we wanted to bring you in today to talk about something that has been in the national conversation for a while, but also very much part of the local conversation. We are talking mental health awareness, and resources. And we recently had a tragedy in the school district. Julie, tell me a little more about what happened and the response.
Thank you for the opportunity to talk about something that is so important to all of us in Summit School District and this community. Just a month ago, we lost a student. A student died at Summit Middle School. And we are a small town at heart, and that kind of loss really impacts our students, our families, our staff. And in the time since that death, we have been working hard to support the kids in our building and our community at large. We know this kind of tragedy can be deeply impactful, not only in the loss of someone so young, but also in how so many of us want to be able to provide support for the kids who feel this loss and for their families.
Yeah, and like you were saying, it was very much a kind of community rallying, giving the support to the kids who were affected by this directly, but then also maybe the children who had heard about it or knew friends or something else. It's a spiderweb effect, something like this.
Well said, Phil. I am so tremendously proud of this community, the way partners come together to support our kids and our families. We are grateful to our Summit Community Care Clinic, Mind Springs, and the numerous private therapists who came to work with us the morning following the tragedy. We must have had nearly 20 volunteers come to help the kids and be there to support them as they heard the news and dealt with the loss.
Great, incredible, like you said, outreach from the community and everyone else. And Cassie, yourself, how does the community care clinic fit into, a situation like this when, students and maybe parents and many people in the community need a little bit of help?
Yeah, so the Summit Community Care Clinic has provided school-based health center services in the school district, the behavioral health component of those services since 2009. And so over the years to today, we've become really well established as one of the main mental health partners for the school district. And so when a big event like this occurs, we are on site and we're able to rally several of our therapists that already know a lot of the teachers and the students and the families to provide an extra level of support to meet with kids individually, to make sure that follow-up gets done, and also to check in on staff and make sure that the way that they're being impacted is also being addressed, because it can have a huge kind of proliferating impact on staff and how the rest of the school year continues.
And I should add, Cassie, the support that our community partners provided to staff, we couldn't have done it without them. But I also want to comment that our counselors, our school psychologists, our school teachers, all of them rallied to support the kids. And I certainly am so proud of how Summit School District, how the team comes together, how we become a family in moments like this, and how the folks who work in our buildings every day really rise to the occasion to support our kids.
Yeah, and it sounds like you very much have a plan in place similar to emergency protocols. Is there a protocol for when an incident like this occurs?
We practice with our crisis response team, which is a select group of individuals in every building, and then we have a district-level crisis response team. And no matter what the event might be, we bring those leaders together, those who have been trained in how to respond, and we go through a fairly rigorous protocol. Everything from what we're doing on the ground operationally with our kids and our staff, but also how we're communicating with our community, with our parents during such a difficult time.
Now, going beyond, the immediate response, talk about the follow-up. We're a month out, and I'm sure that folks are still struggling a little bit to wrap their minds around what happened, and also to, make sense of it all. What happens in the weeks and even months following an incident like this?
Great question, Phil. I would say we have a number of resources built into our schools, and those are ongoing, whether that's counseling services or even some counseling groups for students where they can come together and continue to have that support in the building. Locally, we have a number of partners who are helping us support our families. Just today, for example, Building Hope is sponsoring a Spanish language suicide prevention training program called QPR. And they're hosting that at Summit Middle School for our parents, Spanish and English speaking alike. And I just came from the breakfast, and we must have had nearly 50 people there interested in learning how they can help support not only their families, but people they know in the community. So Building Hope, another great resource, Mind Springs certainly, and FERC, a group that provides a lot of resources to our local families in a variety of ways. I'm sure, Cassie, you know of other resources that I should be highlighting for our kids and families.
Absolutely. I think you've hit a lot of the main ones. I think it's important that people do know that there's always resources in the community. Just showing up at your local doctor's office or the care clinic, those are places where they can get you connected more and more. Based on the national conversation and what we're seeing, people are understanding that mental health and people having struggles with social emotional needs are not isolated to certain individuals or certain families. This is stuff that impacts everybody, and so all of the various kinds of social and healthcare agencies around the community are more and more ready to help guide people to the right kinds of support, whether they need just sort of a brief intervention or if they need something more intensive or ongoing. So in Summit County, we're definitely trying to create a no wrong door for getting people the help that they need.
Great. Yeah, lots of resources, lots of ways that people can reach out. When it comes to what you're seeing, though, as professionals, especially Cassie yourself, what are some of the issues that, students or maybe even adults, anybody that you see throughout the typical day, are specific to Summit County? What are some of the biggest issues that you find with mental health?
So fortunately, Summit County, we've collected some data over the last several years looking at sort of the diagnoses that we see coming in for our mental health services. And fortunately, what we see kind of parallels a lot of the national trends in terms of percentages of people reporting depression, percentages of people reporting anxiety, some of the more kind of basic kinds of mental health concerns. Where Summit County differs a little bit, and Colorado differs a little bit, is in regard to our suicide rate, where Colorado is higher than the national average by about 3 times, and Summit County is slightly higher than even the state average. So in a small community, I think even one loss to suicide is really felt. And so that's an area where certain community groups have focused a lot of efforts and energy around prevention and stigma reduction and education. And like I said, we see a lot of what we see everywhere else, but I think when you have a small community where people have lived here for many years, families have lived here for a long time, you feel those impacts in a different way than you might in a larger city.
I guess I would add to that, Phil, that we are seeing a rise in the level of anxiety and depression in our kids. Just this year, we've received over 120 Safe to Tell phone calls. Safe to Tell is an anonymous tip line that Colorado provides to all youth and adults in this state as a safe way to report concerns that students have about their peers, about themselves, about their family. And while the tip line can be used for things like, school vandalism, theft, bullying, we tend to see a majority of the calls coming in about students who are concerned for a peer, someone that they think is sad, depressed, and maybe expressing thoughts of self-harm or suicide. And while it has concerned us that we see this rise of phone calls, we're also grateful that our students and our families are placing these calls, are letting us know what's going on, and it's a great door that opens so that we can partner with our school-based health centers and get that student some help right in school during the day, quick and immediately, and make sure that we get them on a better path.
Like you were saying, sometimes it can feel a little like a double-edged sword, that the resource is there and you're happy to see folks using it, but it is sometimes a little unnerving to see the steep rise in it. And is that rise very steep compared to, I guess, the 120 calls?
Yeah. I would say by March last year, we'd received about 60 calls, so we have almost doubled the number of phone calls that we received last year. And again, they are not all related to student depression, anxiety, stress, but that is the majority. And it's tough to see that, but I am glad that we can intervene and provide support.
I think also what we're seeing nationally, back to sort of that, comparing our county to what we might see in other places, some of the data that we're starting to see now about youth mental health is showing that there is an increase in depression and anxiety kind of occurring nationwide across the board. So we're seeing it here, and I just want to make that comment that I don't think that it's totally anomalous to Summit County. It's sort of an unfortunate occurrence that we're seeing across the board.
Okay, but it's not all doom and gloom. There are the resources, there are the ways that folks can find help, no matter what level they're at. And that's one thing that interests me, especially at the school district, is that you have patients, for lack of a better word, of all ages, from elementary to high school to the teachers to the staff. How do you, what are the best ways to, help somebody no matter what the age are, or are there different ways of helping somebody?
Well, let me start first, Phil, by talking a little bit about some of the exciting things we're doing in the school district around prevention. We are very grateful to our partners, Kaiser Permanente, locally. We were one of 6 school districts in the state to receive a social emotional learning grant, and we are providing social emotional skill building with our children as early as preschool. Wow. That's funding that the school district didn't have, and a program that we had not been able to train our staff around, but this year we've just launched that implementation, and it will be spread out to all of our elementary schools by next year. Really exciting to be doing that work. Additionally, at the middle school and high school, we provide signs of suicide prevention training, which is a classroom lesson that we deliver to our students to help them understand what they should be looking for in themselves, in their friends, and some skills around what do I do if I'm worried about someone? How do I respond? We've also launched this year a peer counseling program at the high school, where some of our high school students have been trained in mental health first aid, and they help deliver that signs of suicide at our middle school. It was a great way to create some leadership opportunity for our kids, and also build that skill of what do I do if I'm worried about a friend.
Yeah, giving them a chance to be teachers while also providing that information that they're interested in, yes, and that the other students are. Very cool.
And our school-based health centers, I cannot say loudly enough how important that partnership is in our school district. Our counselors in our buildings do a phenomenal job connecting with kids and responding to students when they're in crisis. However, we need the licensed therapist, that real expert, to help us out, and the school-based health centers provide that not only to our children, but to the families and the staff that the school district serves.
Cassie, when it comes to the school-based health center, when you interact with students, what does that look like? Are they coming to your office? Are you guys going into the schools? Is it a mix of both? What's it look like?
That's a great question. So the school-based health centers are located in the school buildings. In Summit County, we have 4 on-site clinics. We have one at Dillon Valley, Silverthorne, Summit High School, and Summit Middle School. And then we also provide on-site behavioral health services in all of the other elementary schools in the county. And what makes this program unique in my mind is that families don't have to travel to get to an appointment. Kids don't have to leave the building to get to an appointment. So the idea is that it creates really easy access and reduces barriers for people who need to be seen, because we know there is a lot of ambivalence around seeking counseling support, people feeling like, oh, there must be something terribly wrong with me if I need to ask for help. And if we can reduce those barriers and see kids right during the school day, it makes a huge difference in terms of the kids and the families that we're able to access. So kids get identified by various avenues. Parents can refer right to the school-based health center. Teachers can refer kids, and then we establish that relationship with the kid themselves or the family, and then they can have ongoing counseling right there in the school through, at some point during the school day, where they're out of class for just a short period of time. It's a lot shorter than if they were to leave the building for an appointment. So we've really seen it be an effective model.
And I'd love to throw in, because we have counselors at the school-based health centers who make really powerful connections with kids, and they've been there now a while. I think they've become a part of the team in each of our buildings. And kids refer not only themselves, but they will, share a referral with a friend and suggest to a friend, hey, you should go see one of those folks over there in school-based health because they do such a good job, and they're really seen as part of the family. We have experienced a rise in the number of visits that kids are making to school-based health centers, and I don't know, Cassie, if you have that information, but I think it's pretty telling how valuable the service is in our schools.
Well, and Cassie, like you were saying, and both of you were saying, one thing you have to fight sometimes with mental illness is the stigma, the thought that if I'm going to get help, there's something wrong with me. And I've talked with Building Hope and some other folks around town, and that's what they say, is that usually that's the biggest barrier right there. Do you find that that stigma is getting better with students? Like you said, there is a rise in students being concerned about themselves and others with Safe to Tell. Have you seen that the stigma is almost going away, or is it case by case sometimes?
That's a great question, and it's probably pretty nuanced depending on which community you're talking about, which gender you're talking about, kind of which cultural group you might be talking about. But I'd say overall, generationally, we are seeing a decrease in stigma around kind of psychosocial or mental health related issues, and that is definitely a positive swing. And we're kind of seeing that because of some of the way that schools are starting to address this, and primary health care is addressing this as a regular, common occurrence. So there's some normalization, I think, about mental health and social emotional needs. And at the same time, it is still a major barrier for people seeking help. For whatever reason, human nature or our culture in general just struggles in asking for help. And so it really is still a barrier. And when we were talking about doom or gloom earlier, I think one bright spot is that we do have a really robust local community initiative with Building Hope working to reduce stigma. We have the school district addressing that. We have primary care facilities saying, hey, this is okay. We're also trying to reduce stigma. So to me, that's a really bright spot in terms of the doom or gloom picture of all of this.
Our Building Hope Coalition is something special, and strongly supported by the Summit Foundation and the Patty Casey Memorial Fund. Building Hope is just a group of community volunteers who care deeply about the people that live here. And it's exciting to see some of the work they're doing around connecting events, getting people out and helping them meet others or experts in the field of mental health to get some support. They're also providing vouchers to adults and kids to help them access services if they don't have the financial means. It's a great community support.
Yeah, and that was great. I met with Betsy Casey actually a couple weeks ago. And yeah, it was incredible to see just the growth that program has had. It's only a year old. It's not very old at all. And I think it also comes down to the passion that everybody involved there has for it. And that also really helps. It seems like, when people are dedicated to their mission, man, they can go really far.
That's right.
Finally, the last thing is, moving forward in the future. I know there's lots of great things in place. We were talking about plenty of stuff that is already in place or, growing. Any thoughts on other future stuff that could be done or other things that, might have been done elsewhere that could come to Summit sometime soon?
One thing that we are working really diligently to launch this fall is some intensive programming for adolescents in our community and in both Snowy Peaks and Summit High School. And what it would look like is sort of an intensive outpatient program is really what we're going for, where kids who are identified to be kind of at the highest risk for psychosocial, emotional needs, maybe they have been hospitalized because they were unstable or we're trying to prevent them from getting hospitalized. This would be a program that would run out of the high school that kids could get sort of elected into, and families. There's family work involved too. And we would be able to kind of deliver mental health services in a condensed and intensive way where they're having individual work, group work, some family work, maybe some psychiatry support if they need that for a determined period of weeks. And we'd be doing evaluation and sort of assessing, are they meeting their goals? Are they more stable? Are they having less suicidality? And that's a program that in a rural community and through school-based health has never been done before. You might find these programs, the closest ones near us would be in Denver or in Grand Junction, and that's just not an option for families. They can't take that kind of time off work. They can't have their kids out of school. So we're hoping that a program like this will really help to stabilize some kids that we see popping up in chronic crisis time over time, and it's going to be super innovative, and it's a huge partnership with the school district and the Care Clinic and Mind Springs Health, so we're really excited about that.
Yeah, very cool. That sounds like you were saying, something that just has not been reasonably available to folks here in town. And again, getting rid of those barriers is one of the biggest issues, along with the stigma and just having resources available. Very cool. Well, I think that was about all that I had for you, unless you had anything else.
My last plug, Phil, and I do this often, is to remind everybody about Safe to Tell. Folks can access Safe to Tell at safe2tell.org or by calling 1-877-542-7233. We strongly encourage kids and families to report their concerns, because we know if they say something, we can do something. So help us make a difference.
Absolutely. And like we've been talking about, small community, small town, lots of support right there where you might least expect it, but know that it's there. Great. Well, Julie and Cassie, thank you again for coming in to talk mental health in Summit schools and across Summit County today.
Thank you so much.
Thanks, Phil.
Of course, Julie McCluskie and Dr. Cassie Comeau on Krystal 93.